Well, we just got through celebrating Heart Health Month. It was a reminder then and now to always put your health and well-being first. Now, in the sponsored segment, my co-host Chris Tomer took a trip to South Denver Cardiology to learn more about women's heart health and what you need to look out for. Take a look.
All right, we're here at South Denver Cardiology Associates, and we're talking about women's heart health. And I'm with Dr. Cinthia Bateman. You're a cardiologist here, and Whitney Groth. You're a nurse practitioner. Thanks for joining us on this.
Thanks for having me.
Talking about this important topic here today. So I got to ask you, what are the symptoms when it comes to women having a heart attack versus men?
Well, women ask us this all the time, and women and men can have the same symptoms. The classic symptoms of a heart attack are chest pain, shortness of breath, often sweating and nausea. Men and women both report that they sometimes get jaw pain or back pain, neck pain. We say sweating is a bad sign of anything when you're sweating and you shouldn't be. But the bottom line is women sometimes do have different symptoms than men, but they also have the same classic symptoms, so we don't want anybody to ignore anything.
Yeah, but come in, sit down, have a conversation.
Yeah.
That's the bottom line, right?
Yeah.
So as far as, if a woman were to say, what can I do about this? What do I need to think about? How can I attack this problem?
In terms of coming in and seeing us?
Yes.
Well, then we talk a lot about lifestyle modifications to sort of reduce the risk factors that you have, right? We look at your overall risk factors. Do you have family history? Do you have high blood pressure? Do you have high cholesterol? And once we do that, then we say, okay, let's always protect ourselves. We have to exercise on a regular basis. We have to have a good diet. And then we say, are you at a risk enough? Is your age at the proper sort of where we want to do further testing to see if you have heart disease or not? And there's a variety of tests that we can do to do that. One of the biggest things we do is a calcium score. We try to see if you have coronary calcifications or not. We don't want to do it too early because women do develop heart disease in terms of coronary calcification about 10 years later than men. So sometimes we will wait until women are a little bit older, but it doesn't mean that we shouldn't be treating their risk factors from the beginning.
I got to ask you about younger women that may have a heart attack. Is there something unique there?
There is. There's a specific type of heart attack that younger women have, typically between the ages of 40s, mid-40s to mid-50s. And instead of the typical plaque buildup heart attack, it is where the coronary artery itself, the inside wall, comes uncoiled. And that in and of itself blocks the artery, the flow of the blood. And then oftentimes you can develop a little blood clot in there, and that will completely occlude the flow even, and it causes a heart attack. It is very much just as dangerous, and it's treated the same. And if you are a young woman and you have symptoms, classic symptoms of a heart attack, or even slightly not classic, but it's something very out of your ordinary, please go get that checked out. And you're between those ages, because we've seen that. We have personal friends who've had this happen to them too. But it can be treated.
You both have worked here for a long time, right? I mean, you've probably seen all kinds of different things here at South Denver Cardiology Associates. And I mean, you would recommend people just to come in, right? I mean, what's the best advice you've got?
If you have family history, if you have any questions, if you're concerned about any symptoms, just come in and talk to us. Because I think everyone is very different in how they present. Everyone's an individual. And let us help you tease it out.
Well, Cinthia and Whitney, thank you so much for having me in here today to talk about women's heart health. Obviously a very important topic. If you have any concerns, just give them a call here at South Denver Cardiology Associates, and they'll definitely take care of you.
Wow, lots of knowledge right there. Amazing information. So more information on women's heart health as well as the services at South Denver Cardiology, everything they have to offer, just go to their website, southddenver.com, or give them a call at 303-744-1065. We want to give a big thank you to South Denver Cardiology Associates for sponsoring that segment.